Why stroke symptoms differ between men and women. Stroke symptoms can manifest differently in men and women, and understanding these differences is crucial for early detection and effective treatment. Females, biological, hormonal, and anatomical structures contribute to these variations. Women, be aware of the unique signs you may experience. Estrogen has been shown to have a protective effect on the cardiovascular system. However, changes in estrogen levels during menopause can increase the threat of stroke. These fluctuations can lead to different indications of a stroke in women, such as headaches, nausea, and general weakness, which might not be as pronounced in men. Women are more likely to experience ischemic strokes caused by a blood clot, rather than hemorrhagic strokes caused by bleeding in the brain. Sudden confusion, disorientation, or even fainting are less commonly recognized as signs of a stroke compared to the more traditional symptoms such as numbness or difficulty speaking. Anatomical contrast in the brain and cardiovascular system between men and women can affect how a stroke presents itself. Research shows that women may experience hiccups, general weakness, or fatigue more frequently than men during a stroke. These atypical symptoms can often be mistaken for less severe conditions, delaying critical medical intervention. Recognizing these gender-specific differences is vital for timely diagnosis and treatment. Persistent hiccups. Persistent hiccups can be more than just a minor annoyance. They can be a warning sign of a stroke. While most people associate hiccups with eating or drinking too quickly, hiccups that last for more than 48 hours, known as intractable hiccups, could imply a serious underlying health issue, including a stroke. When a stroke occurs in the brainstem, notably in areas like the medulla oblongata and the supratentorial cortex, it can affect the nerves that manage hiccup reflexes. This disruption can lead to prolonged hiccups that don't respond to typical remedies. Women experiencing persistent hiccups should be especially vigilant, as they might not immediately connect this with a stroke. Besides persistent hiccups, other accompanying issues might include chest pain, shortness of breath, and an unusual sensation of warmth. If you experience these signs, seek medical attention immediately. Early intervention can drastically improve the chances of recovery and reduce dangerous complications. Does pregnancy raise the risk? Pregnancy raises the danger of a stroke, especially during the third trimester and the postpartum period. This is due to several physiological changes that occur in a woman's body during pregnancy, which can contribute to the likelihood of experiencing a stroke. During pregnancy, a woman's blood volume increases by about 50% to support the growing fetus. This heightened blood volume, combined with hormonal changes, can cause blood clot formation. Blood clots can travel to the brain, causing an ischemic stroke. Estrogen surges contribute to changes in blood vessel walls and raise blood coagulability, further enhancing clot formation. Pregnancy also places more strain on the cardiovascular system. As the body works harder to pump more blood, blood pressure can rise, leading to preeclampsia and eclampsia. These conditions are characterized by high blood pressure and can cause blood vessels to constrict, reducing blood flow to the brain and increasing the risk of stroke. Preeclampsia is particularly dangerous because it can cause both ischemic and hemorrhagic strokes due to the high pressure exerted on blood vessel walls. After delivery, the body returns to its pre-pregnancy state, which includes normalized blood volume and pressure. This transition can sometimes result in fluctuations that contribute to a stroke. The first 6 weeks postpartum are critical, as the body undergoes rapid changes. Pregnant women need to be aware of stroke indicators, which can include abrupt, severe headaches, changes in vision, dizziness, and unilateral weakness or numbness. Prenatal care is a must for monitoring blood pressure and managing any conditions that may arise during pregnancy. Sharp pain in leg muscles. Sharp pain in the leg muscles can be an unexpected and peculiar warning sign of a stroke for women. While leg pain is often associated with conditions like muscle strain or peripheral artery disease, its quick and sharp onset could point to a more serious underlying issue, such as a stroke. Stroke occurrences can affect the part of the brain responsible for motor control and sensory perception. If the stroke impacts that region, women may experience sharp leg pain, which includes the onset of weakness or numbness in the legs, difficulty walking, loss of balance or coordination, and a swift, brutal headache. Other factors that can contribute to the likelihood of a stroke are DVT, deep vein thrombosis, or blood clots in the legs. Clots can travel to the brain, causing a stroke. Pregnant women, those on hormone replacement therapy, or women with a history of blood clots should be extremely vigilant about instant leg pain and other related matters. Neck pain on one side. Neck pain, when it occurs suddenly and on one side, can be a bizarre but important warning sign of a stroke in women. While neck pain is commonly associated with muscle strain, poor posture, or stress, it can also suggest a disturbance in blood flow to the brain due to a stroke. Having a stroke can affect the blood vessels that supply the brain. If these vessels become blocked or ruptured, it can cause a sharp pain in the neck. This pain may be due to the carotid artery, which runs along the side of the neck, becoming compromised. Women experiencing this type of neck pain might not immediately associate it with a stroke, but don't ignore it. In addition to neck pain, it may include an acute headache, dizziness, weakness or numbness on one side of the body, and difficulty speaking or understanding speech. Migraines with aura. Migraines with an aura can be an abnormal warning sign of a stroke, mainly in women. A migraine with aura is characterized by visual disturbances such as flashing lights, blind spots, or other sensory changes that occur before or during a migraine headache. Understanding this condition and its potential link to stroke is crucial for early detection and prevention. An aura typically involves visual anomalies, but can also include other sensory disturbances, such as tingling in the hands or face, difficulty speaking, or hearing hallucinations. These usually develop gradually and can last for up to an hour before the onset of a migraine headache. While migraines with aura are generally not harmful on their own, they can indicate a stroke. Research on women who experience migraines with aura ranks for an ischemic stroke, which occurs when a blood clot blocks a blood vessel in the brain. The exact reason for this magnified risk is not fully understood, but it may be related to the changes in blood flow and vessel function that occur during a migraine with aura. Oddly, factors such as the use of oral contraceptives and smoking can further elevate this. It's important to manage and reduce high blood pressure, smoking, and obesity to lower the overall stroke risk. Brain fog. Brain fog, characterized by confusion, difficulty concentrating, and a general sense of mental fatigue, can be an important warning sign of a stroke in women. While brain fog is often associated with stress, fatigue, or hormonal changes, it can also suggest a disruption in the brain's normal functioning due to a stroke. During a stroke, the brain's blood supply is interrupted, depriving brain cells of oxygen and essential nutrients. This interruption can affect cognitive functions, leading to brain fog. Women experiencing a stroke may find it hard to think, remember simple things, or make decisions. These cognitive difficulties can appear without warning and can easily be dismissed as mere forgetfulness or stress. In addition to brain fog, women might experience confusion and difficulty speaking or understanding speech. If they happen out of the blue and intensely, they should be checked. The hormonal changes women undergo, especially during menopause, can also play a role. Estrogen has a protective effect on the brain, and fluctuations in estrogen levels can make women more susceptible to stroke. Racing heartbeat. A racing heartbeat, also known as heart palpitations, can be an irregular sign of a stroke. While a fast heartbeat is often associated with anxiety, stress, or physical exertion, it can also indicate an underlying cardiovascular issue that heightens the risk of stroke. This condition can result from atrial fibrillation, AFib, a common type of irregular heartbeat. AFib causes the upper chambers of the heart to quiver instead of contracting effectively, which can lead to blood pooling and clot formation. If a blood clot travels to the brain, it can cause an ischemic stroke. Women with AFib might experience shortness of breath, dizziness, or fatigue. These symptoms can be intermittent or persistent and might be mistaken for anxiety or other less severe conditions. However, it is crucial to recognize that AFib-related palpitations can increase stroke risk fivefold. In addition to a racing heartbeat, indicators might include unexpected weakness or numbness on one side of the body, difficulty speaking or understanding speech, and intense headaches. The combination of these issues with a racing heartbeat should prompt an immediate medical evaluation. Being aware of the link between a racing heartbeat and a stroke is vital for timely intervention. Women should pay close attention to their heart health and seek medical advice if they experience persistent or unusual heart palpitations. Early diagnosis and treatment of AFib and other cardiovascular conditions can lessen the risk of stroke. If you experience a terrible headache or neck pain, along with additional symptoms like vision changes, confusion, or weakness on one side of the body, seek medical attention immediately. Hey there! If you find today's content helpful and informative, don't forget to like, comment, and subscribe. Only you can help us grow. Your support helps us create more valuable health tips and guides for you. Stay healthy and stay tuned.